Thank you very much.
So yeah, I'll just give quite a brief presentation about the first HRC project grant we were funded to do, which is a scabies prevalence study for New Zealand. So it was this paper's been published. It's Children's Scabies Survey indicates high prevalence and misdiagnosis in Auckland educational institutes. So the objective was to determine the prevalence of scabies in childcare centres and primary schools in Auckland. And again, where parents gave consent, children were examined for scabies, and questionnaires were completed, and we looked at relevant symptoms. We asked parents about socio-demographics, history of skin infections, itch, and what treatments they might have followed. And yeah, the diagnosis was categorised with regards to the IACS criteria of clinical and suspected scabies, and it was made with clinicians. Clinicians that carried out the exam had undergone training with the Melbourne expert from the World Scabies Program, Dr. Dan Engelman. And the survey was stratified, a stratified random sample of school and early childhood centres. And yeah, PCR tests for scabies were also taken to complement the clinical criteria that were collected as well. So yeah, these are the results. COVID was kind of running in parallel to this, and so it kind of interrupted things, but we didn't have a great response rate. This diagram on the top shows how many schools from how many childcare centres we invited from low and high SES, and as you can see, we invited quite a few, but not many participated. In the low decile childcare centres, we invited about 15, of whom 4 participated. We invited 13 from the high SES areas of childcare centres, and 1 participated. So there were 5 early childhood care centres that participated. And with regards to schools, in low SES areas, we invited 4 and 1 participated. And in high socioeconomic status areas, we invited 4 as well, and 1 participated as well. So a total of 7 educational institutes, 5 ECEs, and 2 schools participated in the study. And I think what we found was that schools and ECEs that thought there was an issue with their children's skin were more willing or likely to participate. So a lot of our findings, they're not really generalisable for a large part of the community, but I think for ECEs in high deprivation areas, we're most confident in our results for that group. And yeah, it resulted in about 101 children from early childhood education centres and about 80 children from schools, 181 in total. And a big part of the IACS criteria is getting the history, and we only had 145 out of the 181 children. We got questionnaires back, so that limited the whether we could fully determine whether they'd meet IACS criteria. The average age was about 5.5 years old, and you can see the ethnicity of the children that participated. There's about 42 Pacifica, 40% Māori, 14% New Zealand European other, and 4% Asian. So when it comes to scabies prevalence by IACS criteria, the first line overall we found about 13.2%, and that's a weighted amount, a weighted value prevalence. The prevalences I've given here for Pacifica, Māori, New Zealand European and Asian, they're raw data, so about 21% for Pacifica, 20% for Māori, and 7% for New Zealand European, and 2% for Asian. And these haven't been weighted, and I think maybe the higher than expected prevalence for New Zealand European is probably because we didn't have a lot of statistical power there. There weren't many New Zealand European. So 13.2% overall, that's for ECEs in high deprivation areas, is the prevalence we found there. We found that if we looked at atypical and typical scabies lesions, about 51% of children met that criteria in ECEs. But again, because we didn't have all the surveys, they didn't form part of the IX criteria. Another thing that we done is we took PCR tests. So there were 64 PCR tests taken, and of those, 15 were positive, which is 23%. But of those 15, for those 15 positive tests, none of those children were receiving scabies treatment. So the point about misdiagnosis is we showed on PCR that 15 had scabies, but none of them were receiving any treatment for scabies. 5 of them were receiving treatment, like topical skin treatment for other skin issues. And yeah, so that's, we feel that misdiagnosis was shown in our prevalence survey, and it kind of matches up to what we found in the very first study that we done in the ECE, in that single early childhood education centre. Yeah, and so conclusions. The prevalence of children with scabies is high in early childhood care centres in Auckland. Misdiagnosis is suggested as several or all the PCR positive cases were not receiving any form of scabies treatment, and instead were being treated with topical agents used to treat other skin conditions. And this is the reference that you can look up. So, thank you. So, any questions?